So we just started talking about diabetes here and the criteria of diabetes and how to differentiate between type 1 and type 2. So another case here. Mrs. D is a 55-year-old female, diabetic. She's on multiple diabetes medication, including metformin and glipizide. Her creatinine is now 1.8. How would you manage her diabetes in the hospital? So a lot of times, patients come into the hospital and they are already on some sort of a diabetic management at home, whether it's oral medication, insulin, or what have you. So you have to be very familiar of how to take care of patients when they're diabetic and they're admitted to the hospital. So there's a couple of learning points in this case here. So the first point is that any patient that gets admitted to the hospital, a lot of times or most of the time, we just manage them with insulin. So this patient is on oral medication, metformin and glipizide. Most of the time, especially with metformin, we stop metformin. The problem with metformin is that it can cause pretty severe lactic acidosis. And when you order any exams that includes any contrast, it actually asks you if the patient is on metformin or not, because you have to kind of wash out the kidney before you give these patients any contrast. Again, there is a high chance of having lactic acidosis. So in general, if you get patients who are on any oral diabetic medications, usually these medications are stopped in the hospital and we just start them with insulin sliding scale. So in your hospital, you have protocols of different insulin sliding scales. How this works though, I'll explain that here shortly. But you usually have a low sliding scale, a moderate sliding scale, or a high dose sliding scale.